There's been so many new scary headlines, cases, infections, hospitalizations, all the numbers are up. What are you seeing on the ground at your hospital?
Having me back. So, it's certainly a different pandemic for us on the front lines now compared to this winter and certainly as far back as 2020. And so what I see in the ER now is patients present with a different kind of virus. So it causes more of an acute flare-up or exacerbation of patients' chronic medical problems. So diabetes, high blood pressure, chronic kidney disease, chronic lung disease. So it's a much more different dynamic than what we were used to with patients coming in before vaccines, before this widespread immunity where they had pneumonia, low oxygen levels, requiring ICU admissions and much more heavy resource use. So it's certainly been a huge paradigm shift for us in the front lines.
Well, it's really important on the ground information, doctor. So it sounds like in the past, at the beginning of the pandemic, we had relatively healthy people coming in because they were sick from COVID. COVID made them go to the hospital. It sounds like, and correct me if I'm wrong, what you're seeing now primarily are patients that do have other unfortunate chronic medical conditions that COVID is either making worse or sort of bringing back up. Is that a fair way to characterize it?
Yeah, I think that's accurate. And even if you look past to earlier in the year when you and I spoke last, and it was much more easy to differentiate patients that coming in for COVID or with COVID, just testing incidentally. And I think that kind of definition has been muddled lately because it's not as clear cut where you see a patient with viral pneumonia, low oxygen levels, and you're like, oh, this is definitely COVID. So I think that warrants a difference in how we need to look at what this virus is doing. But I think the key point to remember is that COVID is causing acute flare-ups, these chronic medical problems, but that is the bread and butter of what we see in the ER all the time. And it's much less resource intense than it was in the winter and certainly a few years ago when every patient came in with viral pneumonia requiring high levels of oxygen, respiratory therapy, the ICU, and possibly a ventilator.
You know, there's not a lot of states that put out a lot of clear information. I like to use Massachusetts because I think they do the best job of any state that sort of separates all the stuff so we kind of know really what's going on. And ahead of this interview, doctor, I was looking at Massachusetts. In Massachusetts, there's nearly 600 people in the hospital with COVID. About 30% of them are there for COVID. And as somebody who has two parents that are over the age of 80, I wish everybody good health, but almost every patient, more than 60-some%, were over the age of 80, and the plurality of those other ones were over the age of 70. Is this particularly right now a time where those, and by the way, 60% are fully vaccinated in Massachusetts. The elderly seem to be, again, the super high-risk group. What can we do to protect them?
Yeah, I think the most important thing, as we saw from the recent CDC data, is that if you have not gotten a booster of anything in 2022, now is the time. And I think the patients that I'm seeing that are requiring admission for these acute flare-ups are usually patients that haven't had that second booster. So especially the elderly of the elderly and the people over 50, they need to get that second dose as soon as possible.
Yeah, and wishing them best the recovery. We're showing the graphic there, number of hospitalizations in the state of Massachusetts. Doctor, how many more variants, when you guys talk in your private moments or, in research or whatever you do, how many more variants should we expect? It's BA.5 now. My buddy works at Hopkins. He's a virologist. He expects variants pretty much forever, I think. I mean, what do you think?
Yeah, it's really hard to say. I mean, this virus has completely, once again, shocked us over and over. And I think the most important thing we have to remember is that there is just so much background immunity right now. And so when we talk about whether BA.5 is, more intrinsically dangerous than previous variants, it doesn't really matter, is my point, because if you look at what's happening on the front lines, what we see in the ER, because everybody's been vaccinated, because a lot of people have been vaccinated and exposed, you're seeing less severe disease, you're seeing less intensive COVID disease requiring that hospitals have to divert critical resources and not see as many patients. And so I think we have to, just keep an open mind and be prepared as best we can, and especially looking ahead to the fall and the winter.
You're working on the ground at a big hospital, doctor. How many people in the last, say, 30 days, and just, you don't have to be exact, an approximation, have you seen personally that are there for, not with COVID, not they got hurt and then they tested positive? How many people have you seen there for COVID that needed medical attention?
Yeah, I think in the last month, I had one patient that was triple vaccinated, hadn't had a second booster, that required admission for viral pneumonia, which is something I had not seen since the winter. And I mean, I was honestly kind of shocked to see this, but he did well with just supplemental oxygen and had a relatively short stay in the hospital. But I'm certainly seeing a lot of people that have the acute flare-ups of their chronic medical problems. But again, that's what we do in the ER day in and day out. People whose chronic medical problems just get worse for whatever reason. COVID is just something else.
Why aren't we, doctor, I know we got to go, and I'm sorry to drag this on, producers, Evan, and everybody, I'm sorry, but I got to ask this. Why aren't we talking more in this country about just better general health?
Yeah, I mean, that's a great question. And I think, you have to talk about vaccination hand in hand with what people are doing to better their wellness, their exercise, their diet, and all those other factors are equally as important.